Have you noticed your legs aren't as strong as they used to be? Maybe getting up from a chair takes more effort, or walking upstairs has become a real challenge. If you're over 60 and experiencing these changes, you're not alone, but the cause might surprise you. While we often think vitamins are our allies in the fight against aging, research shows that too much of certain vitamins might actually be weakening your legs. That's right. Those supplements you're taking to improve your health could be doing the opposite. Before we continue, if you want more honest, science-backed health advice for seniors, click the subscribe button and notification bell so you don't miss our weekly health updates. Today, we're going to explore something rarely discussed in senior health circles: how excessive amounts of two common vitamins can compromise your leg strength and mobility. You'll learn which vitamins to watch, how they affect your muscles and bones, and most importantly, how to find the right balance for optimal leg strength. This information could be the missing piece in your health puzzle, especially if you've been diligently taking supplements but still experiencing declining mobility. Stay with me. What you learn today might completely change your approach to supplementation and help you regain confidence in your steps. After age 60, our bodies undergo natural changes that affect how we move through the world. Let's talk about what's happening beneath the surface that might be affecting your mobility. Your muscles gradually lose both mass and strength, a process that accelerates after 60. Medical professionals call this age-related muscle loss sarcopenia. Think of it as your muscles slowly becoming less dense and powerful. By age 70, many adults have lost 25 to 30% of the muscle mass they had in their 30s, with leg muscles often showing the most noticeable decline. Simultaneously, your bones are changing too. Bone mineral density naturally decreases with age, making bones more fragile and susceptible to fractures. Women experience this more rapidly after menopause due to hormonal changes, but it affects everyone as they age. Your joints, those crucial connections between bones, undergo their own transformation. The protective cartilage thins, and production of lubricating joint fluid decreases. These changes can lead to stiffness, reduced flexibility, and discomfort during movement. Together, these changes create noticeable effects on daily activities. Standing up from a seated position requires more effort. Walking distances that once seemed easy now feel challenging. Navigating stairs becomes a thoughtful process rather than an automatic action. Maintaining balance becomes more difficult, increasing fall risk. Recovering from minor exertion takes longer. These shifts can gradually limit independence, affecting everything from grocery shopping to personal care. Many seniors find themselves modifying activities or avoiding certain movements altogether. What's fascinating and not widely discussed is how nutrition plays a critical role in either accelerating or slowing these changes. Particularly interesting is the relationship between certain vitamins and your leg strength. While proper nutrition is essential, emerging research shows that the relationship between vitamins and mobility isn't always straightforward. In fact, some vitamins that are absolutely necessary in proper amounts can actually work against your leg strength when levels become too high. Understanding this balance is crucial because many of us increase supplement intake as we age, believing more is better. Let's examine how this well-intentioned practice might be affecting your ability to move confidently and independently. We've been taught that vitamins are essential for good health, and they absolutely are. Your body needs these micronutrients to function properly, supporting everything from immune function to energy production. However, when it comes to vitamins, balance is the key word. Many seniors follow the logic that if some is good, more must be better. This approach can lead to excessive supplementation, often without proper guidance. The truth is that vitamins function best within specific ranges in your body. Too little creates deficiency symptoms, but surprisingly, too much can create its own set of problems. Think of vitamins like the instruments in an orchestra. Each plays an important role, but if one becomes too loud, the entire performance suffers. Your body works the same way, requiring harmony among nutrients rather than an overabundance of select components. What makes this particularly relevant for leg health is how certain vitamins directly influence your musculoskeletal system. Some vitamins affect bone density, others impact muscle function, and some influence both. When these vitamins fall out of balance, your mobility can suffer, often in ways that mimic normal aging. This brings us to two specific vitamins that, when consumed in excess, may actually contribute to leg weakness after 60. These aren't obscure supplements. They're common vitamins that many seniors take daily, often in doses much higher than their bodies need. Before I reveal these two culprits, I'd love to hear about your supplement routine. Do you take daily vitamins? Has your doctor ever tested your vitamin levels? Share your experience in the comments below. And if you're finding this information helpful, please give this video a thumbs up. It helps others find this important health information. Now, let's unmask the first vitamin that might be secretly undermining your leg strength. Vitamin A. First culprit. Vitamin A is truly essential for your health. It supports vision, particularly night vision, and helps maintain healthy skin, teeth, and bones. It's also crucial for your immune system, helping your body fight off infections. In the right amounts, vitamin A is your ally in healthy aging. However, when vitamin A accumulates beyond what your body needs, it can negatively affect your bone health and, consequently, your leg strength. Here's what happens. Excessive vitamin A activates specialized cells called osteoclasts, which break down bone tissue. While this breakdown is a normal part of bone maintenance, too much vitamin A throws the system off balance. Your body begins removing bone tissue faster than it can be rebuilt. The result? Decreased bone mineral density, increased fragility, and a higher risk of fractures, particularly in weight-bearing bones like those in your legs. Research published in the Journal of Bone and Mineral Research found that older adults with the highest blood levels of vitamin A had nearly double the risk of hip fractures compared to those with moderate levels. Another study from Sweden tracked more than 2,000 men for 30 years and discovered that those with high vitamin A levels had a significantly higher risk of osteoporosis-related fractures. Where might you be getting too much vitamin A? Common sources include multivitamin supplements, especially those marketed for eye health or immune support. Fish oil supplements, which often contain vitamin A. Dedicated vitamin A supplements. Liver and liver products, which are extremely high in vitamin A. Fortified foods, including many breakfast cereals and meal replacement shakes. Warning signs that your vitamin A levels might be too high include dry, rough skin, headaches, blurry vision, joint and bone pain, hair loss, nausea or dizziness. If you're experiencing these symptoms and take supplements containing vitamin A, it's worth discussing with your healthcare provider. The challenge with vitamin A is that it's fat-soluble, meaning your body stores excess amounts rather than excreting them. This allows it to accumulate over time, potentially reaching harmful levels even if your daily intake seems reasonable. Understanding this mechanism doesn't mean avoiding vitamin A entirely. It means finding the right balance. For most adults over 60, getting vitamin A primarily from colorful vegetables like carrots, sweet potatoes, and leafy greens provides benefits without the risks associated with high-dose supplements. Vitamin D, second culprit. Vitamin D stands as one of the most recommended supplements for older adults, and for good reason. It helps your body absorb calcium, maintains proper bone structure, and supports muscle function. Low vitamin D levels have been linked to increased fall risk, muscle weakness, and bone fragility. Many doctors routinely recommend vitamin D supplements, especially for those with limited sun exposure. This creates an interesting paradox. While vitamin D deficiency certainly harms leg strength, excessive amounts can be equally problematic. When vitamin D levels climb too high, your body absorbs too much calcium from your digestive tract and pulls additional calcium from your bones into your bloodstream. This condition, called hypercalcemia, can cause significant muscle weakness, particularly in the legs. The excess calcium interferes with normal muscle contraction and relaxation, leaving muscles feeling weak or fatigued. How does this happen? Your muscles contract properly only when calcium flows in and out of muscle cells at precisely the right times. When your bloodstream contains too much calcium due to excessive vitamin D, this delicate process becomes disrupted. Your muscles can't generate force efficiently, coordination suffers, and fatigue sets in rapidly. Research from the Mayo Clinic found that patients with vitamin D toxicity commonly report profound leg weakness as a primary symptom. A study published in the Journal of Clinical Endocrinology and Metabolism documented cases where older adults taking high-dose vitamin D supplements experienced a 30% decrease in physical performance tests, primarily affecting lower body strength. Common supplementation pitfalls include taking multiple products containing vitamin D without realizing the combined dose, following internet advice suggesting extremely high doses, misinterpreting blood test results without professional guidance, not adjusting supplementation as seasons change, less may be needed during sunny months, taking megadoses weekly or monthly instead of smaller daily doses. The risk increases because many seniors take calcium supplements alongside vitamin D, potentially amplifying the hypercalcemia effect. Signs your vitamin D levels might be too high include unusual fatigue, leg weakness, excessive thirst, confusion, digestive discomfort, and frequent urination. If you experience these while taking vitamin D supplements, consult your healthcare provider promptly. Finding the right balance is key. Many seniors benefit tremendously from moderate vitamin D supplementation, particularly during winter months or when exposure to sunlight is limited. The goal isn't elimination but optimization. The impact of vitamin A and D imbalances doesn't occur in isolation. Several additional factors can magnify their effects on leg strength, creating a more complex health challenge for adults over 60. Medication interactions represent a significant concern. Many common prescriptions can alter how your body processes vitamins. For example, certain cholesterol medications can increase vitamin A absorption, while some blood pressure medications may affect vitamin D metabolism. When these medications combine with high-dose supplements, the risk of negative effects multiplies. A healthcare provider shares, "I often see patients taking multiple medications alongside supplements without realizing how they interact. This creates a perfect storm for nutrient imbalances that affect mobility." Physical activity naturally declines with age for many seniors. This reduction creates a troubling scenario when combined with vitamin imbalances. Regular movement helps maintain bone density and muscle mass regardless of age. However, when physical activity decreases while vitamin imbalances persist, the negative effects on leg strength accelerate dramatically. Consider how these factors connect to common age-related conditions. Osteoarthritis, the wearing down of joint cartilage, affects nearly 80% of adults over 65. When excess vitamin A weakens bones near already compromised joints, pain increases, further reducing movement. Similarly, sarcopenia, age-related muscle loss, progresses faster when vitamin D levels are improper and physical activity declines. This creates a concerning cycle. 1. Vitamin imbalances contribute to initial weakness. 2. Weakness leads to reduced activity. 3. Reduced activity accelerates muscle and bone loss. 4. Additional weakness further limits movement. 5. Limited movement contributes to more health complications. Breaking this cycle becomes increasingly difficult without addressing all contributing factors simultaneously. The combined effect often appears simply as getting older, when in reality, it represents a modifiable health situation. Many seniors accept declining mobility as inevitable when specific, addressable factors are actually responsible. This understanding offers hope. By managing vitamin intake appropriately while addressing these compounding factors, many seniors can maintain, or even improve, leg strength well into their later years. Now that we understand how vitamin A and D can affect leg strength, let's focus on finding the right balance for optimal health. For adults over 60, the recommended daily intake of vitamin A is 900 micrograms, 3,000 IU, for men, and 700 micrograms, 2,333 IU, for women. For vitamin D, most health authorities suggest 800, 1000 IU daily for seniors, though individual needs vary based on sun exposure, skin tone, and geographic location. The source of your vitamins matters significantly. Food-based vitamins typically come with built-in safeguards against overconsumption. Your body processes natural food sources differently than concentrated supplements, often with better regulation mechanisms. For vitamin A, consider these balanced food sources: orange and yellow vegetables, carrots, sweet potatoes; dark leafy greens, spinach, kale; red bell peppers; Eggs in moderation. For vitamin D, balanced sources include fatty fish like salmon, twice weekly. Egg yolks. Fortified milk or plant milks. Moderate sunlight exposure, 10 to 15 minutes several times weekly. Regular monitoring provides the best protection against imbalances. Blood tests can accurately measure your vitamin levels, helping guide supplementation decisions. The 25-hydroxy vitamin D test is particularly valuable for assessing vitamin D status, while retinol levels help evaluate vitamin A. Dr. Margaret Wilson, a geriatric nutrition specialist, notes, "Many of my patients are surprised when we test their levels. Some taking high-dose supplements actually have excessive amounts, while others taking nothing are deficient. Individual metabolism varies tremendously. Consider these monitoring strategies. Request vitamin level testing during annual checkups. Schedule follow-up tests after making significant supplement changes. Keep a supplement diary noting any changes in energy or strength. Track seasonal differences in how you feel, especially regarding vitamin D. Perhaps most importantly, partner with your healthcare provider before making supplement decisions. Bring all your supplements to appointments for review. A healthcare provider can help determine appropriate dosages based on your specific health conditions, medication regimen, and lifestyle factors. Remember, supplementation should be personalized, not standardized. What works perfectly for your neighbor might be completely wrong for you. Beyond balancing vitamins, there are practical ways to maintain and improve your leg strength after 60. Let's explore strategies you can implement today. Start with these gentle home exercises that build leg strength safely. Chair stance. Sit on a sturdy chair, then stand up using minimal hand support. Aim for 10 repetitions. Heel raises. Hold on to a counter. Rise onto your toes, then lower. Try 2 sets of 10. Leg extensions. While seated, straighten one leg. Hold for 3 seconds, then lower. Alternate legs for 10 repetitions each. Walking. Even 10 minutes daily strengthens legs and improves circulation. The key is consistency over intensity. A little movement daily provides more benefit than occasional strenuous activity. Support your exercise efforts with leg-friendly nutrition. Prioritize lean proteins, chicken, fish, beans, Greek yogurt, to support muscle maintenance. Include potassium-rich foods, bananas, potatoes, oranges, to optimize muscle function. Stay hydrated. Even mild dehydration can reduce muscle performance by 10 to 15%. Consider collagen-supporting foods like bone broth to nurture joint health. Small lifestyle adjustments yield significant benefits. Break up sitting time, stand or walk briefly every 30 minutes. Practice balance activities while brushing teeth or waiting in line. Choose stairs when feasible and safe. Wear supportive footwear, even at home. Create a nighttime routine that includes gentle leg stretches. These strategies work most effectively when combined with proper vitamin balance, creating a comprehensive approach to leg health. I'd love to hear which of these strategies you already use or plan to try. Share in the comments which exercise seems most manageable for your current ability level. Has anyone noticed improvements in leg strength after adjusting your supplement routine? Your experiences might help others on their health journey. We've covered significant ground today in understanding how vitamins affect your leg strength after 60. Let's review what we've learned. Excessive vitamin A can accelerate bone loss by activating cells that break down bone tissue, potentially leading to weakness and increased fracture risk. Meanwhile, too much vitamin D can cause hypercalcemia, disrupting muscle function and directly weakening your legs. The key message isn't to avoid these essential nutrients, but to approach supplementation with informed caution. More isn't better, balance is better. Working with your healthcare provider to determine your specific needs is crucial. A simple blood test can reveal whether you're deficient, optimal, or excessive in these important vitamins. Remember that maintaining leg strength requires a comprehensive approach. Appropriate vitamin levels through balanced nutrition. Regular, gentle exercise to maintain muscle mass. Consistent movement throughout your day. Professional guidance for your unique health situation. By taking control of these factors, you can maintain independence and mobility far longer than you might expect. Age-related changes are real, but their impact can be significantly minimized through informed, proactive health management. If you found this information valuable, please hit the like button and subscribe for more evidence-based senior health content. Share this video with friends or family members who might benefit from this knowledge. What vitamin-related questions would you like us to address in future videos? Let us know in the comments below.